let's start with the first thing, which is why Virtual Incision?
Well, as we've discussed in our previous conversations, I'm really proud of my role and the part I played in helping to build Intuitive. And when I left, I kind of felt that it was an exciting industry, an exciting time in my career, but wasn't dying to go to the next robotics company. I'd already done it once, felt like I had a tremendous amount of success, but I certainly kept my eye on the market. And so I didn't get called on every robotics job, but I got called on a lot of them. And I consistently said, no, I don't want to do that. And part of it was loyalty to Intuitive. I just sat down and wrote down what would it take for me to get back into robotics. When I really started digging into Virtual Incision, I thought that it was really unique and different, and it fit my criteria. And so I decided to get back in.
You can't replace part of the brain. Like, you
treat them the same.
Source of truth for the MedTech industry.
Who exists with the products.
Robot understands things automatically.
#1 show in the MedTech industry.
So Stryker got ahead of that and changed in the $90 billion company. They had held up high. A lot of things. You stayed in MedTech.
With your host, Omar Khateeb.
Hey everybody, welcome back to the show. I don't need to do much of an intro for our guest. As I like to say, current people's champ. Yes, we have a lot of people's champ. Joseph Othman, the people love you too. But, you know, based on the numbers, one of our top performing episodes, Jim Alecxih's very first appearance on this show. He's since been back. This is appearance number 3. And let me set up by saying this. You know, for those of you, for whatever reason, are not aware of Jim led global sales over at Intuitive during the, early years of Intuitive, built it out from a few salespeople and a few $1 million in revenue to, close to over $1 billion in sales, multiple salespeople, I think in the hundreds. And since then has never gone and worked at another robotic company because, granted, Intuitive is a formidable player. That's not a company you want to go up against. And then I get this press release that comes up on my timeline that Virtual Incision has a new CEO, and that CEO is Jim Alecxih. And so from the moment that happened, I texted Jim. I said, Jim, you got to get settled into the role, but as soon as that happens, you got to come on the show and talk about it. So Jim, it's so good to have you back on. Thank you for coming on. How are you doing?
I'm doing great. So nice to sit and talk with you again. I enjoy your episodes when they come out, so I'm happy to be invited back, and I'm happy that my episodes have outpaced many others. I won't name any names, but you know who I'm talking about. And so it's,
you got some stiff competition. Very stiff competition.
You've had some really great guests. I always am anxious to see who you're going to talk to. So thanks for having me back.
Absolutely. Now, before we get into it, I just want to level set for context with the audience. So I'm going to share my screen for those who are watching on, let's say, YouTube, or perhaps are watching it on Spotify. Here's the if you can learn more at virtualincision.com. MIRA is the robotic system. As you can see, it's a very small robotic system. Essentially, it's the world's first miniaturized robotic system. Okay, as you can see there, somebody's holding it with one hand. So that being said, Jim, let's start with the first thing, which is why Virtual Incision?
Well, as we've discussed in our previous conversations, I'm really proud of my role and the part I played in helping to build Intuitive, and so when I left, I kind of felt that it was an exciting industry, an exciting time in my career, but I wasn't dying to go to the next robotics company. I'd already done it once. Felt like I had a tremendous amount of success, but I certainly kept my eye on the market, and so I didn't get called on every robotics job, but I got called on a lot of them, and I consistently said, no, I don't want to do that, and part of it was loyalty to Intuitive. I love that company, and I'm proud of that product, and think the people that work there are pretty awesome as well, and so. But part of it was I just didn't see the elements that I thought it would take to be successful. And so over the course of time, I just sat down and wrote down what would it take for me to get back into robotics. And that list coincided with what I thought it would take to be successful in robotics. And And so I really came up with four things. And I thought to myself, if an opportunity ever came along and I found a product and a company that fit these four criteria, I might be interested in. So let's tell you what those are. So the first is, I felt that the market was ready for a different form factor. And so it's almost as if people saw Da Vinci and said, well, that one works, and so I'm going to build one that looks just like it. And so my theory was that if you had a de-featured Da Vinci, something that looked and felt like the standard, people would just say, give me the real thing. Why would I step outside the intuitive ecosystem to use a de-feature system for a discount or and you have usually a smaller set of instruments, less innovation, less reliability, all the things that would attract you to Da Vinci, you would be giving away. And what's the upside? Because it looks and feels just like it. And I couldn't think of a single market. I really looked, Omar. I couldn't think of a single market where one form factor covered the entire market. I mean, there are different airplanes, there are different boats, different cars, different computers. I mean, you go down every market and you say, well, just here's the one thing that covers A to Z, high to low. So I thought the market was really ready for a form factor. And MIRA and Virtual Incision really, I thought it was uniquely positioned in there. The second was it had to address if there is such a thing as an Achilles heel in robotics or some sort of detraction, something that inhibited broader utilization, it had to address that. And my thought was that the complexity of robotic systems, the need for really a fully engaged, trained nursing staff to drape it, to make sure the arms are properly positioned, the ports are properly placed, all those things. It's a team game. And so I wanted a system that would really address that complexity. And the beautiful thing about it, you show those pictures up front. That's not a picture of just our robot, in a sterile environment. That is it. There are no drapes. What that nurse was holding actually goes inside the patient, and so we don't have any drapes. Our marketing department has come up if a hospital can execute on a cystoscopy program, take a cystoscope out of a tray, put it together, hand it to a surgeon, you could have a fully functional robotics program. So that was the second thing. The third was that there had to be a true white space in the market. And, when I left Intuitive, I took a CEO job for a company that was headquartered in Shenzhen, China, and had an office in Atlanta. And I commuted to Shenzhen for 2 years. And I remember coming in, I was the CEO. I sat the marketing folks down and said, what's our go-to-market strategy? And somebody said, well, there are 2 billion people in China. If we get 1% of the market, we're going to be rich. And I said, that's not a go-to-market strategy. That's an aspirational statement. And I think a little bit's true about the robotics industry. People see a $200 billion market cap, 95, 98% market share, whatever it is. And they're like, well, the market's ready for a number two, or there are access issues, none of which I think are real true white spaces in the market. And I defined white space in the market as where the entrenched players in the market, who are Intuitive and whoever you want to say, either don't want to go or can't go. And so how would we take the remaining open and straight stick laparoscopy cases and convert them to robotics cases? That's really the white space. And I thought that, that goes quite nicely, dovetails with low complexity, if that's your target market. And then there was the fourth thing, which I think is the most important. I don't believe in loss leader cases in medical device. It's really hard to fix your cost structure in this industry. And so if you want to play in an open market, You have to be able to have positive margins, have great margins so you can sustain yourself. And so you look at some of the burn rates that other companies in the robotics market have, and it's just unsustainable. And it's because they lose money with every case. And so I wanted a business that had their cost of goods that was, tightly managed, that we could come out and have a great margin from inception, from case one, that I didn't have to build the business and fix it at the same time. And so I never found a company that fit those four criteria. And when I really started digging into to Virtual Incision, I thought that it was really unique and different, and it fit my criteria. And so I decided to get back in.
I love that. And just for our production team, and also just for the audience as well, can you just summarize real quick? So those four criteria are
a different, unique form factor, low complexity, a true white space in the market, a beachhead opportunity, and a cost structure that allows positive margins from inception.
Now, something that I do so talking about on the cost structure and the white space. So you mentioned that the robot does not need to be draped. Does that mean the robot that I was just showing, that entire thing, is disposable?
No, it's we have a per use fee, and the robot can be used 15 times, and then it's sent back to be serviced at our factory, and we service it like new and send it back to the hospital. And so it's not disposable. It has disposable instruments on the end. The end effectors are disposable, but the robot itself is reusable.
Got it. So the end effectors are disposable.
That's correct.
When, what can you walk us through sort of like the clinical applications and use case of like why a physician or hospital would adopt, let's say, MIRA over, what we often see in the market, whether it's Da Vinci or any other robot that's like that?
Well, I think there's a wide variety of things. I mean, our initial beachhead market is to really go where there is no MIS. If you go on Google and type in MIS deserts in the U.S., you'd be amazed at how there are big portions of the country that still do open surgery. And we're in the industry, and so we're involved in like kind of the high tech part of the industry. So it's easy to assume to get a confirmation bias that everybody uses it. Like, why in the world would you go to a procedure and have it done open? Well, because either straight stick laparoscopy or robotics is not offered. And so, when I first came into Intuitive, one of the strategies that we developed was building a return on investment analysis for our customers that said, if you can expand your catchment area, if you can consolidate patients from small hospitals into a robotics program, the financial benefit to a hospital is just amazing. That just drops to the bottom line. And so if you remember 15 years ago, you would drive down the road and see all kinds of Da Vinci billboards. That was the culmination of that strategy. Hospitals advertising that they had a robotics program, trying to expand their catchment area for new patients. And so that consolidation strategy is starting to reverse itself. And people don't want to go into big hospitals. They want to have it done in ASCs. And in rural communities, there's a big push for the critical access network hospitals, about 1,700 of them in the U.S. Those people want to stay at home and have procedures done in their local communities. And so our target market is really to provide the ability to have reproducible robotic surgery in an environment where there's very little laparoscopy and primarily open surgery. And so Da Vinci's not our predicate. If you drove our system, as proud as I am of it, if you drove our system and compared it to a Da Vinci, you'd pick Da Vinci 100 times out of 100. But they're not our competitor. They're not our comparator. Our comparator is that there's large incidence of open surgery and laparoscopy that has a high conversion rate back to open surgery. And if we can drive that to robotic surgery, and if you believe, as I deeply believe, in the advantage of robotic surgery holistically, regardless of the company, I believe robotic surgery is superior to open and straight stick laparoscopy. And so if we can drive that, I think there's a societal effect, there's a financial impact that's really beneficial. There's a clinical impact to patients. And so our value propositions line up perfectly with all our stakeholders.
Yeah, on that note, we one of your episodes, again, both your episodes are top 10. One of your other episodes is when we discussed the importance of the value prop, right? And what kind of value prop do you present to the hospital, to the physicians? And so when you look at a market that's been dominated by legacy giants, let's say like an Intuitive, what exactly is Virtual Incision's like wedge, and how do you win against like an incumbent like Intuitive that has such an entrenched OR real estate where you don't have a lot to win, right? There's not a lot of room to grow.
Yeah, I mean, I think that people are concentrating on point of care, but I think that there are other factors as well. It's type of procedures, it's approach to those procedures, and so you look at hysterectomy in the U.S. and you think, certainly, I mean, I lived through laparoscopy, LAVH, I mean, Da Vinci in hysterectomy. You think at this point, hysterectomy has to be dominated by minimally invasive and laparoscopic or robotic surgery, but in fact, it's not. There's a lot of open hysterectomies in the U.S., and so we're agnostic to our point of care. We think that we fit better in community hospitals and ASCs just from a complexity standpoint and the ease of use. But really, our primary focus and our value is in low acuity care cases. So cholecystectomies, hernias, and hysterectomies are really our beachhead. And so there's so much market opportunity in open surgery. And there are other companies that are trying to kind of go head to head with Intuitive, like in the ASC, and saying, I can draw those patients, out of the hospital and out of Da Vinci programs into an ASC with a different robot. And that may prove a good strategy. I don't know. Ours is a little different. We're starting in smaller accounts and we're working up market. And so we feel like we've got a unique go-to-market strategy that really fits with customers' needs. And quite frankly, the most important thing, from a clinical perspective, we feel like this is really good for patients, and it gives physicians an opportunity to execute on robotic surgery and bring all the benefits of that to patients.
Yeah, and I'm happy you mentioned that. When I look at the market post-COVID, a lot of things have moved really to the outpatient ASC centers, just because most people, I mean, look, I'm in Southern California. I have access to Cedars, Scripps, etc. If I need to get a procedure, lab, whatever, I don't want to go to a big hospital and center. And, of the robotic systems that are out there that are focusing on smaller footprint, mobility, et cetera, for the ASC market, MIRA seems to be the one that's like best positioned to serve those kind of markets. And something that I wanted to point out that I really liked on your guys' website. Let's see. Let me see. I think I had it on a different screen here. Here we go. Let me pull this up real quick. Was that essentially that you have a screen that kind of compares your mainframe robotic assisted surgery platform to the MIRA, and there's like a huge difference visibly based on like the amount of real estate it takes up. And so I'm wondering, if we, without like sharing too much, obviously, if you're able to think and share like creatively outside of like outpatient, I feel like because of the footprint you guys have, there are maybe other potential like in-office procedures that you guys can start tackling that no other company can.
Yeah, I mean, I think that goes right to to really two market dynamics. First is, and I love businesses where, the macroeconomic or market winds are blowing in my direction. It's hard to run a company going against the stream. And so if you look at, we're in a existential nursing crisis, and physicians for that matter, but nursing for sure. And so the ability for ASCs and community hospitals to have a set Da Vinci or a set robotics team that are trained is next to impossible. The staff's too transient. They're doing too many different types of procedures. And so you look at, and I'm not talking about Da Vinci particularly, this is all the systems. You look at the draping and the setup, they just couldn't execute. Even if you gave them one, they couldn't execute on it. And so, you're going to have a system that strips all the complexity out of the device. That if you can take it out of a tray and you can click blue dot to blue dot and plug it in, it works. And that's the amount of complexity that you need to be able to make it reproducible, particularly at lower volumes. I mean, if you're doing, 350, 400 cases a year with your system, well, people become really facile quickly. But if you're a company that wants to drive account independence, where you don't have to have a rep there every time, you have two choices. You can have a low complexity device that people can reproduce, or you're going to have a rep there every case. They're almost going to be part of the staff, and that's really expensive from a cost of sales perspective. So I think that's a competitive advantage that we have that's really going to play out over time.
And I think that's an important business model. I had Armin Vidian, who is the managing partner over at Recode Ventures on, and they're more of a tech-heavy venture capital firm but they invest in healthcare and MedTech. And we were talking about this, that one of the problems with med device and MedTech in terms of raising money and commercializing is that they have a really, really bad, outdated business model, which is like having a rep in the room for all kinds of things. It just doesn't work. How have you guys been able to get around that with Virtual Incision? Because again, of all the medical device. What's going on, everybody? Let's take a quick commercial break. If you're a senior MedTech exec, you're going to want to listen to this. It's a very exclusive invitation. Many of you have asked me about, beyond these super large conferences where you get, really overwhelmed by the expo and all these vendor pitches, is there something a little bit more intimate, more exclusive? Well, I'm going to flip the script for you. I've partnered with Thomson Reuters on their Reuters events side, and they're bringing MedTech USA 2025 in a month, less than a month actually, happening November 3rd and 4th in Boston at the beautiful Revere Hotel. This is not your typical industry gathering. Let me tell you a little bit more about it. First of all, it's curated, guest list only. It's an invite only VIP event, and it's being capped at only 200 industry invitations, okay? So 200 senior leaders to be exact, okay? It's invite only. It's designed really for real conversations, smart case studies, and high-value meetings with people who actually move the needle in MedTech. There's no booths, there's no noise, just real conversations with high-value connections and a smart strategy that's curated for people who actually move markets. So if you're a director level or above at a MedTech company, your pass is pretty much covered. You don't pay anything. Reuters actually backs people who drive change. That might be you. You're going to hear directly from executives at Medtronic, J&J MedTech, Philips, Zimmer, Baxter, and more. I looked at the guest list and I was super impressed by it. Even me, I'll be making my way out there. If you qualify, they have an upgrade, which is a hosted buyer program that's going to match you with vendors who already solve very specific problems to you. This is going to cut months of research into minutes. And even the networking is strategic. They're going to have this thing called the Skyline Social at the end of day one. It's at a rooftop. It's designed to foster very meaningful relationships with peers and industry leaders. So you're going to gain market intelligence on trends, new products, competitor strategies to sharpen your edge and more. There's no fluff, no expo chaos, just impact. So if you want in, do one of two things. Either check the show notes below and click that link, or you can just Google Reuters Events MedTech USA 2025. You're going to go to their landing page, and when you register, the registration is actually an application, because they're going to go through and see, do you actually qualify? So best of luck in your application. Let's get back to the episode. Places that are out there, like robotics, are the ones that end up like really requiring a rep in the room because it's very technical, high tech, capital equipment. And so like, what about the technology and form factor is there that allows you not to have a rep in the room?
Well, you have to mirror existing technologies where they have a level of competence. And so, scrub nurses can open a sterile tray, pull it out. You need to make it so simple that they can reproduce it. So one of the tests we did is we brought in a group of nurses, we trained them, and 3 weeks later, we asked them to do it again. No training, no warm up, just like do it once, come back 3 weeks later to see if they could do it. And so that was kind of like and they did really well, but that was kind of a leading indicator that a low complexity system could answer a lot of the cost of sales. I mean, because you look at a robotics rep, I mean, unless you have a really busy system that they're doing it 3, 4, 5 times a day, then they become completely independent. But if you have newly trained physicians, newly trained nurses, a new account, it is really rep heavy, and you have to have great reps that are there, that are highly present, highly competent. That's an expensive model, and so we're going to continue to ramp our commercial team, but we want to do it judiciously, and I think we have the technology that's going to help us.
I want to dive into that again, because like when I first learned about you was when people from Intuitive were talking about the earliest Intuitive, and that the master of scale in terms of like recruiting top salespeople and building a system that scales to tens of millions and $100 million and eventually billions of dollars in sales was you when it comes to building a sales team. Now that you're back in the robotics space, you're building a sort of a commercial team from scratch. How do you think about it strategically?
Well, I think you have to put the right people in the right jobs, and I think there's and I certainly don't mean any disrespect with this comment. So please, to your audience, take it in the spirit it's intended. But there's a lot of people that came in, later in an Intuitive's development, as the growth started, and that took a different skill set and a different personality than the people that were really early.
More bureaucrats than barbarians, right?
Well, we were certainly more on the barbarian side than somebody, and none of us would have made it in the current Intuitive. Although I say that Henry Charlton was certainly there early on and has done an amazing job. But I think that you have to get the right people, and so I look at attributes first. And, CCEE is something that Gary Goodhart told me, capacity, character, energy, and experience, and how you rate those. And for me, capacity, if you're smart, you're probably going to be successful. And character, I put, high character people are almost exclusively hard workers. There's very few lazy, high character people.
That's a good point.
And energy, like if you just, go turn doorknobs, go educate yourself, go take responsibility for your own career. And then finally, the last one is experience, and I'll give you experience. I mean, it's the school of hard knocks. And so I look for those kind of people, interestingly enough, I'll give you something that's interesting about Intuitive that a lot of people don't know is, and I would like to tell you that I thought about this overtly, but I think it just happened organically. And then once I recognized it, I was like, oh, I got it. Almost everybody from early Intuitive that moved into management had experienced some sort of adversity in their childhood. And it wasn't always a loss. I grew up on a family farm, which is the definition of professional adversity. I hired somebody who was a dairy farmer. Almost all of them came from family businesses of some sort. We had several people who had lost a parent. One of our VPs, I think had 6 or 7 brothers and sisters and lived in a 1-bedroom house. So they all had this commonality that they had overcome adversity early on. And that ability to handle adversity and to like be singularly focused on a goal. And then if you're the leader, if you provide that vision and inspiration, and here's what the goal is, and here's what your part in it, if you combine those two, it really works beautifully. And so, almost no politics, certainly no entitlement, tremendous amount of work ethics, the ability to handle adversity over and over again. Those are the characteristics that I really appreciated early in my career, and probably what I'll build this commercial team out to look and feel like as well.
As a leader, how do you develop that level of culture? I mean, aside from like recruiting the people in like that, how do you maintain that level of culture and competitiveness, especially as you start to grow the organization?
Yeah, I one of the things I'm really proud of in my career, not just Intuitive, but throughout my career, is that I think I nicely balanced a highly competitive environment that was also collaborative. And so I want people to fight like dogs to get to the top, to be the top 1% and do everything they can. But what I won't put up with is people keeping other people down to accelerate their own achievement or their own career. You have to help people along the way. So I've always fostered this environment where, like, if you have to go cover a case, if you have to go help somebody close, if you have experience that will help somebody, that kind of collaboration. And if you can combine those two, because they're kind of they're not diametrically opposed, but they're a little bit opposed to each other. But if you can combine those two, you put something really special together, and you get this camaraderie, and you start to build a culture that like people are really proud to be part of. And that's what I'm trying to build at Virtual Incision.
Look, now that you've been there for like 90 days, I mean, when you come in, so Virtual Incision isn't a new player on the market. I mean, I think lately, the last year or two, they've gotten a lot more awareness out there because of the commercialization, et cetera. But like, what was the first 90 days that you were in? Like, what essentially were you focused on and on accomplishing and doing?
Well, it's only been 60 days, but it feels like 2 years. It's like in dog years, Omar. So
it sounds like a startup.
That's right. Exactly. I think you come in, first of all, you have to decide what's important now, and there are so many factors coming at you. And I think this is a lesson. You don't need to be the CEO of a company to take these lessons. This isn't everybody. The beautiful thing about this industry is reps are essentially running their own business. And, you're out in the field, you're in your car and you're deciding where to go. And like, how do I decide where to go or who to see? So you could have your boss tell you, and you get to a certain level where there's nobody going to tell you what to do. They just want you to figure it out. And so you figure, okay, the first thing I'm going to do is I'm going to categorize all the issues in front of me and figure out like what's important, like what's mission critical. Are there fires burning that are existential threats to the business or to your territory, whatever it may be. And then after that, you say, what's the best use of my time? I mean, I tell people, I talk to investors all the time. I'm like, if you lose $1 million, that is incredibly painful. And, but you can always make it back. But if you lose a year of your life, you never get that back. And so how you allocate time is as important as how you allocate capital, maybe more important. It's not as valued as much, but it's very, very important. So I spend a lot of time thinking about, how I allocate my time, where I put my energy and focus in. And then I would say that the third thing I really look at is how do I manage myself? If I'm tired or if I'm dejected or if I've been told no, and I'm trying to raise funds and I've been told no 10 times in a row, and I walk out and everybody sees that I'm dejected, well, what do you think they think? Like, oh my goodness, like things are things must be really bad. And so how you manage yourself as a leader is really important. And it's the same thing, in your family life. If you come home and you bring all of that into your family, your wife's like, oh my God, like, what do I need to do? And how can I help? And you don't want to do that. You want to project calm and confidence. And so I manage myself effectively. And then finally, high communication. Like I let people know what I'm thinking, and let people know that my frailties as well. I'm not perfect. I'm not, I don't do everything just right. And so, but I'm high communication. We're gonna fix this together. We're gonna drive this to market. We have something special, and there's gonna be ups and downs along the way. And so, being high communication even in the down times. And I think sometimes when things start to go wrong, people assume this bunker mentality and like, I'm just going to fix my own little deal and then I'll come back out of my shell. And there's a cost to pay for that, particularly as you assume more responsibility in your career. People look at you and people judge, what they think about the business and their own security and about you as a leader by how you communicate. So those are the things I spend a lot of time, just thinking about and how I behave and communicate.
Yeah, I think that's such a good point to bring up as well in terms of like how you carry yourself as a leader. I think also, I feel like you and we talked about this, which is you don't think about it, but the way you communicate to your team, something that might seem like benign to you might land very strongly with somebody else because of the title that you carry. And so even whether it's compliments or criticism, you have to be sort of careful about how you do that. Would you agree?
So over the course of my career, lots of people have asked me what's the difference between a director and a VP. There's probably people in this audience who are directors or who are managers want to be a director who wants to be a VP who wants to be a chief commercial officer. You're like, what's the big difference? I mean, so I'm managing 20 people now, I'm managing 35 or 40 people. Like, there's not that much difference. And so, one of the things I've always told them is there are two big differences. The first is the amount of gray decisions, where you have a decision to make and there's no right or wrong. It's just gray. If everything were black and white, you'd be like, well, I'm going to do the right thing. As you move up, there are more and more gray decisions, and they're really, and then you get to a point where they're not even gray. I'll tell you in a year or two if I made the right decision. And so, like, you have to have good decision-making criteria. And my second thing, the difference between moving up into additional responsibility is the power of your words and actions. And so let's say I have a call, it doesn't go well, and I walk out and I'm just going to the restroom down the hall. And there's somebody in the hall and I don't acknowledge them. I kind of just brush back. I'm deep in my thoughts. I'm I'm totally preoccupied. Well, they think, wow, what a jerk. You're like, what's wrong with that? What's wrong with him? And so it's not the power of my words. It's also the power of my actions. And so, and if the same way, conversely, if I stop and I say, hey, I noticed your work product. I noticed that you did something and it came across my desk and I just wanted to say, like, thank you for doing that. How far that goes just because I have a CEO title. And so, like, you have to, as you take additional responsibility, the ability to real-time monitor your own words and actions is an essential tool. Like, it's not like, oh, darn, I shouldn't have done that. Like, no, it's real time. Like, you're walking down the hall and you're totally absorbed in the problem you're trying to fix, the last problem, and you forget what's in front of you. And you need to fix that, like, real time. And you'd be like, and I have, even as long as I've been doing this, I've turned around and said, hey, I'm so sorry I walked by you, catch me up, tell me what's going on. And then I go do what I was going to go do. And I think that's, to your audience, if you're in your career and you're looking to take more, more responsibility, I think those are two things, like have great decision-making criteria and manage your behavior real time. If you do those two things, you're going to be well positioned for success.
I love that. Right now, like with the current team, like what are some of the things that you're making sure to implement? Because I think like also, we're heading into the fall. So a lot of what you guys are going to do now is going to dictate and also influence your penetration in the market, raising money, et cetera, going to 2026. So like, what are sort of the mission critical things that you're thinking about right now as a CEO?
Well, from a commercial standpoint, I think, we're going to be hyper focused on utilization, and we're going to be hyper focused on, I mean, I hate to say this, but like really staying in our lane, and nobody ever read Sun Tzu in this industry. Like everybody wants to do a frontal attack.
Just you and I, right?
Right. I mean, the art of war, what's that? And
but so I want to just tap into this real quick. You're right about the frontal attack, and it's a very ego-driven thing. Explain what the frontal attack essentially is, and why is it a really stupid thing to do?
Well, Sun Tzu was a Chinese philosopher, for those of you that are not familiar, and wrote a seminal book called The Art of War. And it's a must read. I mean, you just like everybody should read that book multiple times. It's not a read and put it on the shelf. It's like, every year you get back out and read it because there's so many pearls of wisdom. But one of his theorems is that a frontal attack on an enemy basically dictates a response from them and takes tremendous amount of resources. Like you're basically attacking their stronghold. And so they marshal all their resources to defend their territory. And you need to put all of your resources into a direct attack on their strongest. And so he was a proponent of a flanking attack. And so while other people are, doing frontal attacks, and you look at, I was at SRS. I wish you'd have been there. It was a great meeting that put on, but it's all that they're all going for the same procedures. They're all going for the same customers. They all look alike. They all act alike. I mean, some of them look so alike that you'd wonder, what the intellectual property laws look like. But it's all like a direct attack on Intuitive's got this stronghold. They have this huge share, and there's this this need for a second player, or whatever it may be, whatever market logic that you use to confirmation bias your way into that it's a good idea to go against maybe the best sales force in the history of the medical device industry and Intuitive. Whatever it takes to convince you, that's what they've done. And my view is I don't want to compete with any forearm robotic system. I want to carve out my own market, something totally different. And the analogy I use is this. We compete with robotics companies as Ford competes to Mercedes. But if you had an S550 and you wanted to pull your boat out of the water, and the Mercedes dealer says, well, hey, I'll give you a free, slightly older, but I'll give you an S500. You'd be like, great, I'll take it. But I still need an F-150 to pull my boat out of the water because it's application specific. And so that's what we want to do. But if the F-150, if Ford decided, you know what, we're going to go and we're going to try to compete with our F-150 against the S500 customer, like that's where we want to go. You're just going to get obliterated in the marketplace. So we know our lane, we stay in it. We're happy. There's all kinds of market models where people have picked a lane sometimes on the low end of the market, if you want to call it that. These are low acuity care cases that we're not in colon, we're not in nephrectomy, we're not in gastric bypass. That's not where we add value. We add value in anatomically specific, straightforward cases, and we add it from a clinical and financial and ease of use perspective. And so, we're going to be hyper focused to make sure our messaging is tight and resonates with our customer, and back to your thing about, value propositions to all your stakeholders. We've got to really nail that. That's going to be a key to our market success. But I will tell you, well, you go ahead. You were going to ask a question.
No, go ahead. No, finish your thought, and I want to take it in an interesting direction real quick as we wrap up. So,
I think, I do a lot of investor calls. We're in the middle of raising a $100 million D round, and so I give my story pretty much all day long, and so people ask me like, hey, what do you give me your crystal ball, and where do you think this industry's going? And so I don't have any opinion on winners and losers. Well, I do, but I don't publicize my opinions on who are going to be the winners and losers. But I would say, here's my prediction for the next 5 years of the robotics market. And this is why Virtual Incision is in such a beautiful place. I think for the next 18 to 24 months, the definition of success for robotics companies, aside from Intuitive, is going to be how many boxes did you place? The public companies are going to, on their conference calls, are going to say, we entered the market with our robot and we put these many systems in, and they're going to leverage their balance sheet and their relationships and their contracts to put as many boxes out. Private companies will put press releases, we put X amount in this country, or we did this or whatever. And then somebody on probably one of the public conference calls is going to ask the question like, hey, what was your instrument and accessory revenue? Like, did anybody use these? And all of a sudden they're going to be like, oh, wow, like this is a utilization business. Mm-hmm. And so there's going to be an inflection point in the market. The inflection point is it's either going to be the laser market where you can open the closet and see like 6 lasers that had coats on them. Like, yeah, we bought one of those, but we still use the other one. And or it's going to be, and you think about how many people have their careers and billions of dollars involved in this market. Given that, the other alternative is it becomes hotly contested on utilization. And so what does that look like? If you say, well, this is going to be a hotly contested market, here's what I would think. First of all, it's going to become a price market at some level. And people are going to try to win the market by saying, hey, we're a lower cost provider than the incumbent. And I don't think that fight is going to be in high acuity care cases like low volume. You can win the gastric bypass market, 30,000 procedures, and still get your ass kicked. But if you win in hysterectomies and gynecology and hernia and api and choles, that's 4+ million procedures in the US. If you win that market, you win. And so the coming fight for utilization, for procedure adoption, is going to be in low acuity care cases. What if you had a form factor that was uniquely fit for that market? That would be an interesting market opportunity, in my opinion. So that's kind of where I think we're really positioned well.
I completely agree with you, and I'll explain why from a different perspective. If you look at, I think if you look at, I'm gonna bear with me on this for a second. Exits have been depressed since like 2019, 2020. And venture deployed a lot of money, not just in healthcare, across the board. in 2021 because they held on to funding and they knew they were going to pay for it, and they're paying for it now. And so as a result, LPs are a lot more strict about how they're doing capital calls.
Yep.
And venture is going to be a lot more specific about where they're deploying money. And if we look in the SaaS industry, like vertical SaaS, I mean, it used to be like adoption in terms of like how many users do you have, how many paying like B2B enterprise accounts do you have, et cetera. But the real leading indicator of success is customer success and, you know, usability or utilization. Because if you show that you have a very strong and long lifetime value of a customer, it says that you can actually, you know, scale this out to the market because, you know, happy customers who use the product often a lot, you're gonna have referrals, you're gonna have all these different things, versus somebody who's like burning through the market. Maybe they're adding, you know, X amount of millions of users a month, but on the back end they're churning through the market, right? I think it's the exact same thing that's gonna happen in medicine, not just robotics, but across the board. Because at the end of the day, what's a lot more important, and again, look at the SaaS industry, is not necessarily how many people are buying it today, but how many times are they using it, because that is going to indicate the lifetime value. And so you're better off, I think, as a robotics company, if you have, you know, let's say 20 accounts and they're using at like 80, 90%, because aside from utilization revenue, your lifetime value is going to be extremely high. You're going to be able to go back and sell that customer an upgraded model and all these other things, right? I think that's like very important. I think that investors are thinking this way. I think MedTech's founders and companies need to think this way as well, because also it requires a lot of discipline, right? You know, I can't tell you how many robotic companies, and not to mention any other companies, who have like a true beachhead they should be focused on, and they're trying to like be something for everybody. You know, to just to show that to an investor, like, oh, look at how big our TAM is. You know.
Well, I agree, and I think the other thing that people fall prey to from a misguided strategy is just give me a little flash of revenue. And like if I put 100 systems out there and I do a couple of thousand procedures, and I'll attract the attention of a strategic, like, hey, I have a market need. And I think that people are going to be like, look, I'm looking at the stickiness of your utilization and the churn, as you mentioned. And how many users are you adding per month that are making this part of their practice? That's the metric. Like, this is a tool I use on a daily or weekly basis, whatever it may be. And if you can start to get that kind of customer loyalty, you're going to build a long-term profitable business. And that's our focus. I mean, I could probably leverage my relationships and probably sell 30 or 40 of these pretty quickly, but we want to make sure they're going in the right places with high utilization and build long-term successful clinical programs. That's going to be our key to success. And so that takes discipline. It takes discipline from a managerial standpoint, from a marketing and sales standpoint. And so that's going to be one of our challenges.
Fantastic. Well, look, Jim, I really appreciate you coming on the show. Before you go, though, I wanted to see for, again, the investors who are following and also the clinicians, for the rest of 2025, what conferences do you guys have that you'll be attending and either exhibiting or just in attendance at?
I'm mostly going to, I'll be at the Piper meeting in New York in December. Of course, I'll be in LSI early next year.
Great.
In your neck of the woods. Maybe we'll play golf this year.
Oh, we absolutely will.
And
that's par for the course. Golf, cigars, MedTech. We have to.
Exactly. But that's probably about it. I'll go to the Jefferies, the conference, but mostly investor conferences, and then we'll start to I think we'll be at AAGL in Vancouver in November. And so, but we'll start to get on the show circuit and really be at more meetings in 2026.
Fantastic. Awesome. Well, Jim, really excited for you, excited for Virtual Incision to follow along. For those who are interested, you can learn more, go to virtualincision.com. If you enjoyed this episode, investors interested in robotics, forward this on to them, or even a clinician, surgeon. As your host, I'm your host, Omar Khateeb. Don't forget to subscribe, give us 5 stars, and we'll see you all next time.